Hello, everyone. Welcome to Michigan Public Health's virtual Admitted Students Day. We're so happy that you're able to join us. My name is Tim Dvonch. I'm one of the faculty members here in Environmental Health Sciences. You're going to have a chance to meet a number of our faculty and students and staff during our session today. The first one I'm going to introduce you to is one of my colleagues, Professor Justin Colicino, who's actually moderating the chat window during our session this morning. Justin, if you wouldn't mind coming around to put that face on camera. Hey, everybody. All right, so before we get started, I'd like to encourage all of you to give an introduction of yourself. Quickly put your name into the chat box and let us know that you can hear us, see us, and more importantly, that you can't hear us or see us, and we'll get whatever issues sorted out as quickly as possible. We're going to ask that you keep your audio and video muted throughout the session. If need be, we can alleviate that and have some interaction. But just to get through some of the formalities of the presentations, things will likely run smoother if we stick to that. But throughout the session, at any point, please, we encourage you to enter questions. Dr. Colicino is going to prompt me. I'll stop and answer questions along the way, as well as later on as you meet other faculty and other students. We'll continue that format. So we would, of course, love to have you here in person, showing you our wonderful School of Public Health, our beautiful campus, the wonderful city of Ann Arbor that we live and work and study in. Clearly, there's no more clear time than now that you all understand the importance of public health and environmental health. It's for times like this that we are so passionate about carrying out this mission. And we're absolutely thrilled and excited that you all are ready to join us in this pursuit. Whether your interests are studying exposures to chemical hazards, physical hazards, biological hazards, whether your interest is studying toxicology, what about exposures to those hazards cause adverse impact on our health? Whether you're interested in environmental health policy and promotion, right? Using that science to inform actually responding and intervening and protecting and improving our health. All of these things are of critical importance, and we're happy to tell you more about all of those here during this time. So I'm going to go ahead and spend a few minutes and tell you about some highlights, some overview of our degree program, some of our curriculum. We'll have a chance for our faculty panel where Drs Goodrich, G, and Neitzel will join and tell you a little bit about their work, some of the cool things going on here at Michigan Environmental Health Sciences. By far the most valuable session you're going to see today is from our student panel. Students Lauren, Megan, and Leona are here today to talk with you. And just so you know, us faculty and staff will be out of the room, so it's all straight talk from the students at that point. You can look forward to. I'll come back after that, and we'll transition to some breakout sessions. And so for those of you interested in the EHS MPH, I'll be there moderating that one. There'll be a breakout session on those of you interested in industrial hygiene. For the MS programs, Dr. Colicino will be moderating that. And then for those of you in the environmental health policy and promotion program interest, Professor Neitzel will be there for that. So really quickly, an overview. Why environmental health at Michigan? A couple of important points right off the bat. It's studying environmental health within a public health context. And again, the current events going on around our country and around our world now easily emphasize how important that is to be happening within a public health context. Our MPH programs, our Masters of Science programs, they're all externally accredited by an organization called CEIF. Those of you specifically interested in our industrial hygiene program, it's also externally accredited by ABET. We do have quite a bit of flexibility. This is We know this is important to students. We know you have very specific interests beyond a degree program. We'll tell you more about that over the next few minutes. You have the option, for example, to pursue dual master's degrees. You have a freedom to take elective courses, different focus areas, different graduate certificate programs that you can look at. Something about Michigan, I'll talk about it again in a few minutes. There are immense resources here available to students. There's immense resources available here to faculty. That's why we're all here. It's such a great place. But we're going to highlight those resources to students. The academic advising that you can expect here, it's one-on-one. You're going to come here and I'm going to be your advisor. Dr. Colicino is going to be your advisor. The faculty that are instructing you in your courses and directing your programs are the faculty that will serve as your academic advisors. Depending on your experiences in undergraduate, where you went to school, you'll likely find this to be a very small context. You'll see us in the hallways. You'll know us on a first name basis. We'll know you on a first name basis. Your class sizes will be small. Your cohort within your program areas, small numbers of students, really tight-knit learning community. And there are just crazy amounts of opportunities, actually dangerous amounts of opportunities in terms of what you all can get involved in outside of the classroom. Various student organizations, lots of service opportunities, lots of professional opportunities, just completely fun social things, you name it. It's all out there. Very quickly, at a glance, about our department here in Environmental Health Sciences. We have a total of 46 faculty members. You can kind of go through those breakout numbers there on the slide. Very importantly, we have 3 research centers and training grants, all funded by National Institute of Health agencies. The Educational Research Center funded by NIOSH, that's the National Institute of Occupational Safety and Health. The other 2, the Environmental Toxicology and Environmental Epidemiology Training Grant, as well as the Michigan Life Stage Environmental Exposures and Disease Center. Those are both funded by NIEHS, the National Institute of Environmental Health Sciences. Our current student numbers, you see them at the bottom of the slide. We have a total of 75 students here in Environmental Health Sciences, with the breakout, as you see, about 53 in master's programs and 22 at the doctoral level. What are some of the things that you can look forward to coming here to Michigan Environmental Health Sciences? I won't go through all the Post-it notes there on the slide, but the expertise here is world-class. All of the faculty that are instructing you, teaching your courses, are the ones that are leaders and innovators in their field. They're the ones presenting at all the big conferences. They're the ones publishing in all the prestigious journals. They're also the ones that are doing translated work where they're in communities and when they're informing policy decision-making along the lines of environmental health and public health in general. You'll find a great sense of community here at Michigan. I mentioned the diverse resources that are available. The University of Michigan as an institution has incredible resources here for faculty as well as for students. And actually, the resources that are here for faculty benefit students. So what we can actually get is seed funding for research projects from the university that allows us to hire students to work on our research projects, develop pilot data, submit larger grants to external funding agencies. That's just one example. Something that you all are certainly very interested in, this is our most recent graduate outcomes report. So this is for students that just graduated in May of 2019 and where they stand statistically in terms of their jobs and how they've advanced since May. And as you can see with those numbers, they've all gone out and got great jobs or are pursuing an advanced degree. They are happy with their jobs, which is also very important in terms of entry-level salary. So this is the starting point, the average salary of $62,500. So those folks are doing well. And then the alumni base. So, that's the 2019 graduate cohort. Our program goes back a long, long time. We've got several thousand environmental health sciences alumni that are out there, which serve as a fantastic resource for our students, for our graduates, when you are applying for internships, when you're applying for jobs, when you're applying for fellowships. Our environmental health sciences alumni are everywhere. They're in all the government agencies, they're in all the nonprofit organizations, they're in all the companies and corporations and consulting firms, etc. So having that degree from Michigan is giving you access to this great Michigan family network. So I kind of alluded to the types of jobs. So this is where most of our students go after they graduate for jobs. And it's roughly divided by 1/3, 1/3, 1/3. 1/3 going into industry or commercial or consulting type firms, 1/3 going into government agencies, most of them in federal government agencies, but also some in state and local, like county health departments, that type of thing. And then another third that's broken down between various nonprofit organizations as well as academia. Some highlights. This is really important. So, you're learning a lot today from us about our curriculum and about our courses and about all the different opportunities, within the classroom. You're going to come, wherever you're going to go for your graduate studies, you're going to spend a couple of years living in that location. And there is absolutely no better place than to come to Ann Arbor. There are some things posted up on the slide here. You can search best of Ann Arbor in Google, and all these things are going to pop up. It's a fantastic place to come and live, regardless of your life stage. Young people, college age, people my age, midlife, faculty, families, children, retirees, you name it. It's an amazing place to be. It's big enough that it has everything you need in terms of great restaurants, culture, arts, entertainment, athletics. It's small enough that it doesn't have terrible traffic congestion. It doesn't have pollution. It has a lot of green space. I encourage you to check out, all the links available to you to learn more about Ann Arbor. And again, we apologize you can't be here to experience it in person this weekend. All right, so let's go through a little bit of some highlights of our program and curriculum, and then a little bit later in the session we'll dig into it. We'll finish with our breakouts where we go through each of the programmatic areas specifically. Again, so when you come to Michigan, what is environmental health sciences? We're focused on improving health for all of us, from local to global, in the places where we live, where we work, and where we grow. So this might mean in community settings, it might mean concerns about households or neighborhood level, it might be in the workplace. When you come here, you might be studying any number of topics. There are a few bulleted items here on the slide, things like water quality and air quality management, studying exposures, where are hazards coming from, what's their source, how are we being exposed, are we inhaling them, are we ingesting them. Identifying these things allows us to intervene in the process. Are there sustainable solutions to these problems? Investigating the causes of disease, the mechanisms of disease. Educating, right? Getting out into the community, so translating the science into interventions and health education. Analyzing risk, hazards, all of the different outcomes, all of the different chemicals. And again, most importantly, this is public health and environmental health. The goal is prevention, right? We don't want to study how bad things are and then try to fix them. We want to identify up front what could the bad things be so that we can intervene in advance before they happen or to limit their impact. So really quickly, some differences. Some of you have applied to and been admitted to our Master of Science program. Some have applied and been admitted to our Masters of Public Health programs. And by the way, congratulations. We're very impressed by your strong applications, your background, and your experiences. So our MS program is primarily research-based. You are taking some courses, but you're doing a research thesis, and you have a thesis committee. And so you are being asked to investigate and learn new knowledge through your work. You're being trained to be a scientist. Your summer between your first year and second year in the program is likely going to be devoted mostly to research activities. In contrast to that, the Masters of Public Health programs are primarily course-based. There's more coursework. Most of your evaluation comes through the course content with the goal of understanding current knowledge, right? What's the state of the science? What's our current understanding? You're being trained to be a professional. Your summer between your first year and second year for the MPH is going to be devoted to an internship that's required. It is worth noting, because most of our students come with this interest, you can come into an MPH program and you are allowed and in fact encouraged to participate in a research project. Most of our students, many of our students do this. So just because you come into the MPH program, it's not excluding you to exposure to a research project. You can absolutely come and participate in that. In addition to your formal degree, whether it's an MS or an MPH, you have the opportunity to complete a dual degree, whether it's the School for Environment and Sustainability, a couple of our engineering programs, the School of Public Policy. You also have the opportunity within some of that flexibility in your schedule in the elective space of your course elections. You can pursue a graduate certificate. This is a formal graduate certificate. It appears on your transcript when you graduate. There's a couple of them listed there, bulleted on the slide. The Risk Science and Human Health is a very popular one to our students. So is the Science, Technology, and Public Policy. These are all options available to you coming to Michigan. So a couple of pies here to help illustrate what some of the course breakout looks like in terms of credit hours. So our Master of Public Health programs, again, you're completing this over 4 semesters or 2 academic years. It requires 60 credit hours total to complete the program. In the blue shades of pie, you can see where it says SPH 13 credits. These are the breadth courses across public health. So leading with an MPH, a Master of Public Health, we want to make sure that you have a strong foundation in the breadth of public health. So studying epidemiology, biostatistics, health behavior, health management and policy, nutritional sciences. You're going to have a strong foundation in all of those as part of your degree program, regardless of your focus area. You're also going to have a fair number of courses within our environmental health sciences core. So this is going to include courses like exposure science and health, essentials of toxicology, occupational environmental disease. So you have this very strong foundation in environmental health sciences. Beyond that, the green pieces of pie in these examples illustrate where your focus area might be. So it might be industrial hygiene, like this pie on the top. It might be environmental health policy and promotion focus area courses, like the piece of pie on the bottom. You also have that elective space. It might be a graduate certificate and so forth. And again, just to emphasize the internships, right? So all of our MPH programs require the internship that most students are completing between the first year and second year in the program. Speaking of which, just really quickly, we have a fantastic Office of Global Public Health here that has lots of money. It's really easy to get $4,000 or $5,000 to support your overseas internship. On the slide here, it's just a couple of examples where some of our students have gone in the last couple of years. But the internship can be completed anywhere. It can be local here to Ann Arbor, the state of Michigan, anywhere in the U.S., anywhere across the globe. In terms of our Master of Science programs, this is how those pies break out in terms of the course load. You can see here the course load is much lighter. If you add up some of those numbers, it's a 36 credit hour degree program, so much less coursework. But again, that's balanced with you're spending a lot more time doing research, pursuing your thesis project. So we still have an SPH core where you're getting some breadth across the public health disciplines. an environmental health sciences core with that strong foundation. A lot of your electives are going to be specific courses that you're taking to help support your specific research topic. And then you're actually getting credit, right, for conducting that research, for completing that thesis work. Financial support. We know this is also really important to students. A really quick overview here. Some of you may have been fortunate enough to receive a merit-based scholarship or tuition award as part of your, or as follow-up to your admission to Michigan Environmental Health Sciences. I mentioned the training grants here locally that support students during their time here. External organizations, there are also opportunities for on-campus employment. We have options for students to become a graduate student instructor or a teaching assistant that other universities might use the term. You can work on an hourly basis, whether it's as part of a research project. It might be serving as a grader in a course. And of course, student loans are always an option for ways to kind of fill out that financial support. After today's session, this is not your only chance for questions. We are all happy to talk with you by phone, by Skype, whatever mechanism you prefer. Later today, this weekend, next week, the week following, our goal is to make sure that you are well informed for your decision making. That's our only goal really at this point, is to make sure that you have all of your questions answered, have all this information at your disposal. So with that, I'm going to go ahead and shift gears and invite our research panel to come in and join the room, and you're going to get to hear a little bit, not much, a little bit about the cool stuff going on here in our department.
Hi, welcome back. We're going to give you a very quick snapshot of some of the research we do here. I'm Jackie Goodrich.
My name is Chuanwu. I'm a professor here in the EHS.
And I'm Rick Neitzel, also a faculty here in the EHS.
And we're just going to give you a quick snapshot of some of the exciting research we do that you could be involved in if you came here. So some of the research that I do is focused on early life exposures. You may have heard by now that nearly everyone is exposed to hundreds or even thousands of chemicals and stressors starting as early as gestation. I'm really interested in looking at how exposures during gestation and early childhood can have lifelong impacts on health and development, and figuring out the mechanisms of how this happens. One of the mechanisms we study is called epigenetics. The epigenome consists of chemical modifications to the DNA that don't change the genetic sequence, but yet have really important functions in gene regulation. These modifications can respond to the environment, and they can have stable long-term changes to gene expression that result in disease risk. We're really interested in figuring out what chemicals can affect the epigenome early in life so that we can prevent the population from getting exposed to these chemicals, as well as trying to find ways to maybe reverse some of these epigenetic changes to make people healthier. One quick more point, the picture of mice there is something we use in the lab because those mice, you wouldn't believe it, are actually genetically identical twin sisters, but you can see that they're extremely different looking and they have different health profiles as well. This entire difference is due to one epigenetic change that can be modified by exposures to chemicals like bisphenol A and can be modified in a positive way by exposures to certain nutrients. So we use this mouse model to figure out what chemicals have these effects and how we can stop them.
One of the good things at the University of Michigan School of Public Health here is that we are teaching the classes, but at the same time we are really at the front line of the research. So we try to bring the best research results and scientific data to our teaching in the classroom. So here you can see one of the class I'm teaching right now is called biological agents. It's the biological materials we are living with. Here, just from this image, you can see that as a human, we are living with thousands of microorganisms, organs surrounding us. And should we be concerned about what we are doing here? And we also exposed to them. We interact very closely every minute, every second. We're when I'm talking, in fact, I'm already share my organisms out, but also I'm inhale organisms into my body. So, should I be concerned about this? Okay. That's really what we are looking at. Most of the organisms we are living with, in fact, is commensal or some are even beneficial. But we do have some organisms or their products that could cause other health to us. So we are studying, for example, how what type of microorganisms or what type of these agents in our environment, how do they survive in the environment, and what's the health impact? Okay, what is health impact? So we really bring how we are doing in the laboratory and into the classroom and use that as a case study, so you have a better understanding of how can we really deal with these biological agents when eventually we cannot really avoid separate us from them. Okay, and from the other end, in fact, we can also how can really improve our health by using some particular microorganisms in our environment. So recent, currently, probably everyone is worried about the coronaviruses. In fact, we use this virus as a case study in our classroom. In this class, we spent a lot of time discuss about these biological agents. How can we deal with it? What kind of measures we have to take? Unfortunately, there's still a lot of unknown regarding these biological agents. So we have to be very cautious, but at the same time, from what we know already with the other biological agents, how can we deal with them? So far, I think in the United States, there's always a lot of concerns, even some debate, controversial information out there, but I think we are taking very precautious measures, and we are dealing very well. From my opinion, I think we have take these precautionary measures based on the scientific data and understanding we have so far. Okay, so that's really just one of the example we have. I believe you may have a lot of questions, so I think in this classroom we can give you some answers out to that.
So switching gears, you've heard from my colleagues here about different types of hazards. So Jackie talked about chemical hazards and how they might cause epigenetic changes. You heard Wu talk about biological hazards. And then the third class of hazards that we deal with in environmental health are physical hazards. So these are things that are sort of energy-based, like radiation, like vibration, like noise. And so I actually teach a class here that's the complement of Wu's class called physical hazards. And so in that class, we learn about exposures to these various hazards and how we can actually reduce these exposures after we identify them to make sure that people are exposed at a safe level or below, not having excessively high exposures. But I'll say, actually, each and every one of you on the session here has exposure to an odorless, colorless, invisible hazard. You're exposed to this every single day of your life here in America or actually wherever you live around the world. And we're learning that this hazard is associated with things like hypertension, high blood pressure, with stroke, with heart attacks, with mental health issues, with cognitive impacts, and also sort of as a side effect with hearing loss. That hazard, of course, is noise, and more specifically, sound exposure. So I'm actually running a study right now, and you can see a few images from this study called the Apple Hearing Study. So we've partnered with Apple to basically do a study to try to understand, at least right now in America, what are people being exposed to in terms of sound, desirable sound, specifically music exposure. So every time you fire up your MP3 player or your phone or wherever else you listen to, maybe people don't have MP3 players anymore, I'm sorry, I dated myself. Anytime you listen to digital music, let's put it that way, and you put on a pair of headphones, you're getting exposed to sound. And that sound, if high enough, can cause hearing loss. It can cause tinnitus, potentially cause all of these other exposures and health impacts. What we don't know, though, is what people are actually exposed to. So now, for the first time, through this partnership with Apple, we have the capability to have people opt into this study and share information about how long they listen to music and and videos and games and other sources of sound, how loud they listen, and we'll get a very comprehensive idea about this particular exposure they have. And for people who have an Apple Watch, we can also sense the environment around people and get a heart rate measurement. And again, coming back to the phone, you can take a hearing test now on your phone. So now, again, for the first time at a national level, we can start to get a sense of how much music exposure people have, how much environmental noise exposure people have, and the impacts of those exposures on their hearing and on their cardiovascular health. So this is just an example of sort of citizen science. You know, these are people like you and me out there just sharing their data with us, and it's going to give us a much better picture of a very important but very uncharacterized exposure that we have and a couple of the health impacts. And so the image on the right that you can see here, one of the things we always want to do when we do a scientific study is make sure how well are the instruments we're using actually capturing the exposure. So here in the center, you have a sound level meter, a very precise instrument that's being exposed to a certain sound level. And you can see there's 5 little Apple Watches on the bottom there that are all reading virtually the same level. So it's really exciting that we now have technology that you can wear and keep on your person that can make super accurate measurements of your environment. So again, this is just a sampling of a couple of different studies and classes that are going on in our department. Of course, if you come here, you'll learn about many, many more hazards and environmental impacts of our surroundings. But that's, I think, what we've got in terms of our studies. And I don't know if there are questions that have been posed that we could answer.
So you already can see there's a real difference in terms of monitoring biological agents, physical agents, and chemical agents. So I really hope that we can have the tools like the Apple Watch you can use to monitor the coronavirus in real time.
Sure, yeah.
That would be great, but unfortunately we are not there yet. Okay, far from that.
Truly. But if you think 10 years ago, this technology was
Right.
science fiction then too. So 10 years from now, who knows? And you come to our program, maybe you're the one to make that invention. Wouldn't that be cool?
And hopefully next week you can do the drive-through to get your test if you really need it to be tested.
Yes, truly. So were there any questions that have popped up, or?
We're still soliciting questions from the audience right now. Yeah, so if anyone has any questions, please feel free to type in the chat box. So we have a question. Do you look at hazards outside of the physical, chemical, and biological? For example, psychosocial, ergonomic, or things similar to that?
That's a great question. I'll take a first stab at it and then invite others to join in. So we absolutely do. Psychosocial stressors honestly weren't recognized as hazards for many, many years, but now are very much on the radar. And certainly things like ergonomic hazards actually fall under physical hazards to a degree. We're also interested in things like injury risks, which don't really fall cleanly into any of these. And so the coursework here that you have both a requirement to take, but also opportunities to take, very much dives into all of those hazards and even more.
Yes, and I would say, too, in most of our environmental epidemiology studies, especially of children, in addition to the chemicals, we almost always consider psychosocial stressors, and in some cases, the interaction between those, or we try to study groups who might be at higher risk because they have more of those stressors than others, which could impact how they respond to chemicals and their health overall.
So because we have a different disciplines, even just in a single department, not mention that in the other departments of school on the university, so give us really advantage to study the mixture of the stresses. So we can study the mixture of the exposure to the mix of the stresses, but also what's the health impact from this type of exposure. And some of courses, in fact, most of you can take the courses in our department, but you can also go to the other departments to select courses if you are interested in them. You have this flexibility. Definitely, you have this flexibility of take the electives in other units.
Yeah, so I think we have another question that sort of follows up on what you were just talking about, Wu. Do you do collaborative research that works with other departments within the School of Public Health or other schools within the university?
Wow, okay.
Yes and yes.
Yes.
Actually, I'll just give a quick example here. So I have a study that's been running now for 8 years with colleagues in Sweden. So this isn't even another university, this is another country. And coming back to the earlier question, so this is a study that's looking at workers who have exposure to a physical hazard, noise, a chemical hazard, paper dust that they breathe in, and a psychosocial hazard, shift work, working nights and days. And so here's an example where we're doing mixtures, basically, of an exposure with colleagues who are completely around the world. But of course, in this age, this is not such a big deal as long as travel bans aren't in place, of course. But yeah, absolutely. I would say we do collaborative research within the school as well. And I don't know if either of you have examples there.
So I just to give you an example, because before I came here, I was writing 2 proposals. So each proposal involved partners, collaborators from different departments, from collaborators from different countries. And this good thing is that, in fact, we also use this as an opportunity to train our students. For example, if I have a project like Dr. Rick Leitzel, he has a project in Thailand, all this. So we use this as a training site to send our students there for some internships or some research projects. So we do the research, collaborative research in a different location, and then we use that also as an opportunity to train our students here.
And I would say one of my favorite projects is a cohort where families in Mexico City have been followed for over 20 years at this point, and this involves the major players right now are people from our department, people from nutrition and biostatistics here, including faculty and students of all levels. And then we also have partners at 2 institutes in Mexico City, as well as a couple of people who are scattered throughout other universities in the U.S. at this point too on the project.
So by the way, our students is instrumental in this collaboration. So basically sometimes our students act as a bridge to bring this collaboration together.
Yeah, you want to talk maybe about the M-Cubed projects too? That's like another like good interdisciplinary thing that also promotes student training.
Sure. I'll take a stab at this. So the University of Michigan, actually uniquely in America, at least to my knowledge right now, has started this program called M-Cubed. And the explicit goal of this entire funding program is to bring together faculty from different units on campus. So basically, you identify 2 other faculty from different units, by which I mean I might go from public health and find someone in engineering, or someone in the Ross School of Business, or the Ford School of Public Policy. We get together, we come up with what we think is a good idea, and we present that idea to the university, and the university counts up how many units we have, and they give us the money. There's no evaluation. It's simply specifically designed to get us together and share these interdisciplinary views. Again, that's a very unique program to Michigan, and it's one that I think all of us have probably engaged in, and has been incredibly successful in sort of bridging the kind of natural gaps between disciplines, but the gaps that we really need to overcome to do the best job we can of protecting public health.
Yeah, so I think this mechanism also benefit our students. You know, if you have a really crazy idea, a good idea, you present to your faculty, and then you can probably like within a week or 2, you can get some money to support to test your idea on this campus.
Yeah, and what's neat about these projects, this is Justin from the corner, sorry, off camera. What's really neat about these projects is that half the money that the university is providing has to go to support a training. So this is like giving the trainees an opportunity to get involved in these super collaborative research projects, and it's like mandated by the university. It's like a really neat program.
Yeah, great point, Justin.
Yeah, I would say we love to have students involved in our research, and for the MS students, especially out there, you'll have to do a research project as part of your curriculum. So, you may work with one of us or our other 17 or so other faculty on that project over your 2 years here.
Yeah, it's a great point. In fact, in just my personal experience as a faculty member, I'd say I've probably had 3 to 5 students from any cohort working on projects in my lab, and these are MPH students for the most part who don't want to go on to a research career but decide maybe I'll just sort of dip my toe in the pool and see what research is like. I think they've all taken something away. Some of them have decided, I had no idea what research involved, but after working on a project for a couple of years, I'm actually thinking about continuing on to a PhD, which is absolutely a possibility. So I would encourage all of you who come, it's a great idea just to get to know the faculty. They may have a project where you say, and I'm not really here to do research, but that project sounds super interesting. How can I participate and contribute?
So one thing I want to emphasize, here at the University of Michigan, we pay a lot of attention to research. The faculty spend a lot of time on research. That's true, because we're a research university. But at the same time, we really use this as a ground to train our students. It's not just to do the research. We are not a research institute. We are a university. So we really use this as an opportunity to provide opportunity to train our students. So that's the reason one thing you can really experience like research, how the research is done in the laboratory, whether you're MPH students or MS, but at the same time, we really bring what we are doing in the lab to the classroom. So I think that's one of the advantages to come to this university. And you are not only just learning the knowledge from the book, but also, in fact, you are learning the knowledge from the front line of the research.
Here's the last question, I think, if we have time. So an earlier slide talked about opportunity for GSI positions for funding and tuition. Are research assistantships also available for MS and MPH level students?
That's a great question. Yeah, the short answer is yes. Even if you don't get a research assistantship, though, so for example, many of the students I've worked with, I've hired as effectively a temporary worker, so they're paid hourly. They don't have necessarily the benefits that come along with a research assistantship, but it's still a paycheck and an opportunity to be in research.
There can be opportunities for the research assistantships. Oftentimes the ones that cover tuition go to doctoral students, but sometimes certain grants are around that need a student, and you're really interested in the project, you could possibly get on one of those.
Yes, so in the mission we have a lot of training grants, the training opportunities to support like your summer research, your summer training internship, but also during your work during the academic terms here. So when you come here, we will give you this information, but at the same time you can proactively search for this information. So University of Michigan team, and we try our best to help you to go through all these opportunities on campus so that you will be able to benefit from that.
Yeah, and we have a last question. I don't know if you have time, or I can also address this. We'll do it right now. All right, so question about when can a student choose a professor as an advisor to instruct and guide their graduate thesis?
That's a great question. So I would say if you've been in contact with faculty, and I imagine each of you has been contacted by at least one, if not multiple faculty, if you feel a very strong connection with that faculty member, it's possible to request them to be your advisor. We do our best when students come in to sort of spread them out so everybody's got the fewest number of advisees possible so we can maximize our time with each student. But again, if you have somebody where you say, I really want this faculty member to be my academic advisor, that's absolutely negotiable. So I think it's something that's your preference. You're going to be assigned someone regardless, but that's not a permanent choice necessarily. And if you want to change, absolutely possible.
Yeah, and if you're talking about how to choose your MS thesis advisor, if this is an MS student, then, most students kind of come in, get to know people in the first semester, and then pick one and start working with them. But if you really want to start thinking about it sooner, you could look into the research and you could start emailing us now and be like, I'm coming next year. Could I work with you on my thesis? And you could get a heads up on that if you wanted to. Okay, well, thank you very much.
Thank you.
Yeah, thanks. It was a pleasure talking
in the fall.
Yeah, absolutely.
All right, hey, welcome back, everyone. We did a little transition there. We got those research faculty out the door. And the most important session here is now our student panel. So I'm really quickly going to introduce to you Megan, Lauren, and Leona, who are here to chat with you and give you all the good, straight stuff without any faculty in the room. So you're going to see me exit the door here and go ahead and ask away, and we'll see you in a few minutes.
Well, I'll start off. I'm Megan, just a little bit more of an introduction. I'm from Kentucky. I am in the Environmental Health General Program. My specific concentration is in environmental sustainability and quality, but that concentration doesn't exist anymore. But that just means that my interests lie in agricultural health. I'm going to continue on to I'm a second year, and so I'm going to continue on to go get my PhD at the University of Iowa. And that's me.
Hi, I'm Lauren. I did my undergrad at Emory in environmental science, and now I'm doing my Master of Public Health here at Michigan in environmental health promotion and policy. And mainly I'm interested in the impact of climate change on public health and food systems and policies to help address that issue.
Hi, I'm Leona. I am part of the industrial hygiene program, so I am mostly interested in workplace safety and working and going into that. So also first year MPH student, and I am from Las Vegas in North Carolina. So start breaking out.
We have no questions yet. Any questions? Oh, why did you guys choose? Why did you people choose Michigan?
You, sir?
Sure. So I applied to 6 schools, and and to be completely honest, Michigan was not high on my list when I first started. I had several issues going in, but I ended up taking a call from the director of our program, and I spoke to Dr. Zellers for 45 minutes, and he sells it well. I really enjoyed it. And then I was able to come to Admitted Students Day, and I also got an introduction to no-fault insurance because I got rear-ended in a rental car. Yeah, it was not a great time, but how everyone reacted to that, I had multiple people come up and give me their cards and everything and said, "Do you need anything? Are you okay? What can we do for you?" So, I mean, that was the sort of thing that I cared about and that I wanted from a school as well. So to know that that's how they treated their students and they wanted to be there for them was very important to me. And then because this program offered multiple extra things that I was very interested in, because I wanted an MPH, I wanted to go back into working, into being professional. I was working before, and so I left work and came back to come back here. So it's been a fun time. And then IH program has several other things that you can do during spring break or something like that for fun. So I haven't regretted my choice at all. I'm very happy with where I've been and the people I've met. We have a pretty awesome cohort from all the departments in general, I would say. And our department's pretty cool.
Yep.
So.
Yeah, well, I chose Michigan specifically for the Environmental Health Promotion and Policy program. So I knew I was looking for something more interdisciplinary, and this would give me the opportunity to do environmental health science, but also take classes in policy and promotion. So that was a big factor for me. And then the other thing is that Michigan is a huge school, so I wanted to go somewhere where there were lots of opportunities, and I can take classes through the law school, the public policy school, the School for Environment, and that's what I've been doing through the EHPP program. So,
yeah. So this decision was a while ago for me. I think what ended up like the last straw was I came to Admitted Student Day, and I just kind of fell in love with the ambiance of like the academic ambiance that is at Michigan. It's very open and encouraging. There's not a sense of competition among the students, which was a big plus for me. I don't do well in those types of situations. And yeah, Michigan was just like a big school and was like a big name, and kind of just worked out that way. Yeah.
So we do have our next question. Everyone on the phone call, this is Crystal. I've been managing the chat box. And so what have been your experiences with personalizing your time in the program to your specific interests?
Okay, so
That's a good one.
that is a good one, specifically because of the SEAF competencies. I'm sure you guys you've been familiarized with those. So with those, there are a lot of requirements as to what classes you have to take. However, there is still freedom to tailor your program to your specific interests. I have gotten to take several classes within the sustainability school that are more towards my interests of like program management and like conflict management, like more of that like interpersonal skills. And then here at the School of Public Health, I'm learning more of like the sciencey stuff. But even in like individual classes, you're able to tailor your assignments like I've written so many things about like agricultural health and safety, even though that's not really an emphasis here, but like with my reports and like projects and things, I am able to just go explore the topic that I'm interested in.
For me, well, this may be very specific to me and my program, but I'm also doing a dual degree with the School for Environment and Sustainability. So I'm staying an extra semester to get that done, but I'm getting to take all the classes that I want to take over there and ones that kind of overlap with what I'm learning here at the School of Public Health. So that's been pretty good for me. The other thing is that the Environmental Health Promotion and Policy program is fairly new, so they're pretty flexible in terms of if you find a class that you want to take that meets those learning competencies for the program, then you can definitely bring that up and try to get it approved. And I've done that. So,
for me, our course catalog can be a little bit more rigid than some of the others because because our program is ABET accredited. So we do have special other extra requirements for classes we can take, but you can really personalize quite a lot, and there are so many more opportunities. Last semester, I actually audited an Ojibwe class, so for languages or anything else that you want to take, they are happy to let you or speak to any of the professors. I'm also part of Dr. Neitzel's research lab, so did that, and then through a general dinner for Workplace Health Without Borders, I started working in another research group there. I mean, just there are so many opportunities here that you can also do to find something interesting. There's so many different lectures going on all over campus or opportunities or something. I mean, even just going and visiting all the museums is kind of fun. Like, so we have an archaeology museum, natural history museum, an art museum, all of the others. There's so many opportunities here that you have to look for them. I mean, they're not just thrown into your lab, but there's so much going on here. It's great.
I think that's one of the perks of being like a big school is that there's pretty much a class in everything. So if you can find the time to fit into your schedule, then for sure.
So we do have a couple questions about housing, either how you found about your housing situation, do you enjoy living? Some of you came from different states, all of you came from different states.
Mm-hmm.
And so can you just talk about the housing situation in general?
Well, I'm not going to lie to you, Ann Arbor housing is rough.
Rough how?
It's okay, so I'm coming from Kentucky, so our cost of living is much lower. So I'll preface with that. But when I was looking at housing in Ann Arbor, it was a bit shocking about the prices. But I managed to find, I connected with someone over the Facebook group for admitted students. I think that's but I connected with my current housemate there, and then she was from Michigan. She did her undergrad here, so like she was able to connect with someone. And now I live in a house with there's 6 of us total, and we live like really close to campus.
Yeah, I think most people tend to find houses in the Carytown area. And I think there are different price ranges. I don't know if either guys live over there, but that's where most people tend to live. And they also find roommates through the Public Health Facebook group for admitted students. Another option where I'm planning to live next year is at Munger, which is the graduate housing. So I know that's an option too. And I think that's pretty streamlined since it's through the university. So if you're looking for something that's more kind of pre-organized for you, then that's an option.
So I have a 1-bedroom apartment, and I found that on the Michigan off-campus housing website. So I would actually highly recommend that whatever school you go to, you check the off-campus housing website and just get a general idea of what prices are like where you are. So I got really, really lucky with my place because I needed a furnished apartment that had a parking spot and everything that was not parallel parking because I can't parallel park at all to save my life. So unfortunately, that had to not be a thing there. So I got very lucky and with finding it because I'm also within walking distance of campus. I live down by the stadium.
Yeah, that's where we're at.
So it's just, I know that there are also people that live out in Ypsilanti or some other places and commute in. That's an option too. I don't know though, like how much cheaper it is. Like some of them.
It's a lot cheaper.
Because I remember the last time that they were talking about Spice Tree or whatever, and like a single bedroom was like $900, and it's like my place. So my place is furnished, completely furnished with everything, parking spot, all utilities included. It's $1,200 a month. It's not like and within walking distance, and I think that's about as nice as you can get. So sorry.
For Brianna, your question about the wait for graduate student housing, I think that's pretty far out of our realm of knowledge. I don't know the answer to that, but I just wanted to note that we don't know, but I did put in the notes about Munger. I think most people that want to get in can get in.
I think that's pretty much the case. I know that applications are supposed to come out at the end of this month, and it's first come, first serve, so I would apply earlier rather than later. Yeah.
So that link is in the file, in addition to the notes for off-campus housing and the bus system, which is fairly robust, in addition to the on-campus buses, which are the blue buses, which are completely free. So just some notes on the resources available in the chat, but we do have our next question, which is, are any of you active in UMISA?
Yes.
I was like, I know the answer to that.
Hi, I am the vice president of UMISA. What would you like to know? We do actually do a lot. So EHSA, so we'll have split social hours with them. UMISA as a whole, we also have started going to trivia pretty frequently. We do pretty darn well at that, by the way, just saying. So we have several other events all throughout each semester and everything. At least monthly meetings, even though that's changed up a little bit obviously now. But no, we're here and we're pretty active. And you are automatically a part of UMISA if you join the program. So if you have any other questions about that, I'm happy to talk to you.
While we're waiting for those, we do have some questions. Can you talk about my favorite topic, summer internships, and what you have done or will be doing?
Yeah, so I'm the only one that's gone on with it. I spent my summer working for the Shanghai CDC. So I was in Shanghai, China, and I was doing a research project with one of the faculty here on vaccine hesitation, particularly the HPV vaccine. So that's a really fun topic right now, vaccines in China. And so I was there with one other student from the epidemiology department, and we visited clinics throughout the city. We would go to a clinic every day and do surveys of parents on their attitudes and knowledge of vaccines, particularly the HPV vaccine, because we were trying to find better ways to promote vaccination and regular vaccination for those vaccines that are like category 2, like they're not free, and you can the elective vaccines. So that's what I did. I had a pretty good time. I speak Chinese though, so that was like a big reason that I went there and was successful there, because having that language background for the international ones is kind of important depending on what you are doing.
So I have my internship hopefully lined up. It's supposed to be in Geneva, Switzerland, at the United Nations Environment Program. I was supposed to be working in the Chemicals and Health branch. I don't really know what's happening right now, so hopefully I'll still be able to go. But if any of you have any questions about applying to go abroad or applying to go to Geneva, then I can answer those.
So I actually have a couple of offers right now. I haven't made a decision. So I ended up only applying to a few places. So currently I have an offer from Los Alamos National Lab. And then there's also a gold mining site in Nevada. So I'm just waiting to hear a little bit more about the offer from Los Alamos so I can better compare them. But you're going to be pretty set. So.
Do you feel like your program has adequately prepared you to pursue your desired career or pick up certifications? There's examples. I don't know what any of these are. CIH, ASP,
yes.
CSP. Okay.
Yes. Okay. So absolutely. One of those things that you can do on spring break, for example, is HAZWOPER training. So hazardous waste operations. I actually just did that this spring break. It was awesome. Cannot recommend it enough. So you will get certified for that. We also have OSHA 30-hour certification that you will also be paid for by COSI, which is generally where you get a lot of your funding for any of the occupational stuff if you're in that. So you will have the option to do those as well. And absolutely for any of the others, so for CIH, you need to be working for 3 years in industrial hygiene before you can take that exam, but we can take it within 3 years because our program is ABET accredited. For CSP as well, you have to wait to do that, but because you are graduating from a safety program that is registered with the Bureau of Certified Safety Professionals, you actually qualify to be a GSP, which is a graduated safety professional, so you don't need to do the ASP, so you can actually be above that. So, but certification-wise, absolutely, you will learn so much in every single part of this program. And then I know that the others have options too. Like this is pretty
We
great.
only have certifications, although that's not true. I'm getting a risk science certificate. It's like risk and human health. And as for preparation, I do feel prepared to go on to my PhD. So I guess, yeah. That's more of like a stepwise, like education. It's always going to prepare you for that.
Yeah, I would just say that going back to kind of Michigan being a big school and having a lot of opportunities, if you want like more experience in one area, there are definitely ways to get that experience. And, you find time in your schedule. If you want to take more policy classes, then you can do that because there are a lot of opportunities on campus. So.
We have 5 more minutes to answer questions. Oh. How have you utilized the alumni network?
I haven't. I haven't really done anything with it.
You had to come to alumni networking night.
Yeah.
Yeah, Crystal.
Yeah.
Crystal is the absolute best for this.
Hi, this is my face. You'll get to know me very well. So there are a number of opportunities. I'll drop the links in the chat box about our alumni things that we have, but we have a few resources that are available. One of them is an online platform that is searchable about our alumni database, and so you can do this by topic, you can do this by industry, you can do this by level of work that people are doing. It's really cool, and people have literally signed up to help you. And so they have literally signed up. I just try to use if you have questions. And so, we all have a relationship here. This is cool. This is what you're coming into. But we also have events that are set up for you to engage in alumni. So maybe it's a lecture and they're coming into class and they're talking to you. Or we also have a giant event once a year that is like my personal baby of Alumni Networking Night, where we have 30 to 40 alumni come into the school. They present a panel that's moderated by students on topics that we're interested in the moment. And then we have an hour of networking practice. So I think we as a careers office really try to approach not just telling you what skills you could have, but also offering opportunities to develop those skills in real time and practice. So didn't know I'd make an appearance, but here I am.
We want to go with one last. We have one last question.
Okay.
So last question is generally, how much free time do you feel that you have, and do you have a job outside of school?
Okay, so I work a lot. I don't have any free time because I work a lot. But I am a research assistant with one of the research centers here. It's Emily, and that's like a part-time job. And then I'm also working as a GSI, which is like supposedly 15 hours a week, but not really. And so there's definitely time to work. Like if you want a job, you could definitely do it, especially a part-time job. Yeah, but then you have enough free time.
So I don't have a job per se, but I'm doing the Dow Fellowship right now. So I'm working on a sustainability project with a client. So that takes up a few hours per week, and we get paid for that. And then I'm also in like a few different organizations in the School for Environment and Sustainability. There are also a few different running groups on campus, so I have time to go there too.
I think I mentioned this earlier. So I also work as a research assistant, and research assistant. There's another sort of research group that I work as part of as well, and then I'm also personally following up some other certifications and everything that I want to do that comes off of having gone to Haswalber. So I think you absolutely have a lot of free time, but then you also end up going off and doing other really exciting things in your free time. So then you don't actually have free time, but it's still fun. So it's what you make of it, I guess.
How much would you say is made up of how much time do you spend in class? Like how many hours per week, or how often do you have classes?
So I have classes. It's been like I usually have classes 4 days a week. That's usually what my schedule's been. Typically, it's been always Fridays off, but this semester it's Tuesdays. And then I spend about 3 to 4 hours in class every day, and then I go to work. So I'm typically here from like a 8:30 to 5 o'clock schedule because I work in the building, so I don't have to leave anywhere. But
Yeah, I would say that's pretty similar to my schedule too. I am doing a dual degree, so I'm taking maybe like one extra class every semester to try to get that all in time. But yeah.
Yeah, I would say about the same. We've only had the 2 semesters, but generally about 3 to 4 hours a day in class. We have to take about 15 and a half hours per semester, so it's pretty straightforward. Thanks for listening to us.
I think we've been muted. Yeah, okay. Thanks, guys.
All right. Hey, welcome back. So I'm sure you really enjoyed the interaction with the students. They are always the hit, the most popular panel as part of this Admitted Students Day. So we're going to transition now to the breakout sessions. You all should have those links for the specific programs. I'm going to make sure maybe we can drop those they're already there. Our moderators are way ahead of the game. But before we say goodbye as a group, I want to, again, thank you for your time. Thank you for joining. And this is just, one more interaction that we have. It's not the last one. Please feel free to reach out to us. Any of the faculty, students that you saw today, any of the other faculty on our website. But most importantly, I'm going to introduce you to Susan Crawford, who is our graduate program coordinator.
The video's on. You have to. Okay, we're okay.
Susan Crawford is our graduate program coordinator, and her information there is up on the slide. Actually, when you send me an email that has a specific question, I usually go down to Sue's office and say, hey, Sue, I need help answering a question. So she is really a resource here in our department in environmental health sciences, so please don't hesitate to reach out to her in addition to the rest of the faculty across the department. Thank you so much. I'm going to see a few of you in a few minutes in the environmental health sciences breakout. Others of you are going to either be with Professor Colicino in the MS programs, Professor Zellers in the industrial hygiene breakout, or Professor Neitzel in the environmental health promotion and policy breakout. Thanks again, everyone. Take care.